Hi, my name is Tammy McGillisky. I'm a financial planner with Legacy Financial Planning, and welcome to our first meeting of Legacy Learning. What we're going to be doing today is talking about healthcare and retirement. We've worked really hard over the past 30 years of my career to make sure that we're educating the community on different topics to help them to and through retirement. And through COVID, we've realized that education is going to be a little bit more difficult. Now we have to educate through the new media, through teaching you through video. So we decided to start this series by talking about healthcare and retirement. And the way we think to begin that is to talk about Medicare. Medicare is extremely complicated and there's a lot of different parts to it. So we've decided to separate it into different sessions. We're going to spend about 20 minutes each time talking about different facets of Medicare. Today, we're going to talk about what Medicare is, as well as how you enroll. And over the next 3 to 4 sessions, we're going to talk about the different parts of Medicare, as well as the tax ramifications and how to make sure you don't pay too much for something that all of us have already paid into. In addition to that, the last session we're going to do is talk about long-term care, something that we're going to find out that Medicare doesn't really cover much of. So to begin off, we've invited Dave Carodi, which is a licensed Medicare specialist. Hi, Dave.
Thank you.
And we're going to be asking him some questions that I'm hoping are some of the questions that are on your mind. So welcome, Dave.
Thanks. Glad to be here.
Awesome. So as we start out today, what I want to talk about is really what is Medicare?
What is Medicare? Medicare is national health insurance for people 65 and older, and some people on disability. It is, in its purest form, it's a marriage between private insurance that you get from the government that you go out and buy, and public insurance that's provided by the government. And those two facets join together. They both have things that work together to form a comprehensive healthcare plan for you going forward in retirement. It's based on a private health insurance model, which means it has deductibles and co-payments and co-insurance. It has gaps, huge gaps in it that you fill with private insurance. That's why you need private insurance to go with the public insurance. Medicare doesn't cover everything, and the things that it doesn't cover, you fill with private insurance. So in order to consider yourself well covered while you're on Medicare, you need private and public health insurance joined together to make one comprehensive plan.
Okay, so I think to make this easy to understand, what I want to do is kind of focus on the public part as well as the private part.
Okay.
So we're going to start out with the public part. What are the parts of the public part, the kind that the government kind of gives us?
Well, the public part is two things. It's Part A, hospitalization insurance. That's free if you've worked 40 quarters in your career or your spouse has worked 40 quarters in your career. You get it for no premium, and it's very good health hospitalization coverage. Part B is also part of the public portion of it, and it is doctors and procedures or medical insurance. It covers services you receive from physicians and other healthcare providers. It covers your durable medical equipment like hospital beds and walkers. It covers you for outpatient surgery, whereas Part A covers your inpatient hospitalization. Outpatient services are covered on Part B, and both of them cover some forms of home health care.
Okay, so that's the public part, but I didn't hear anything about drugs in the public part.
Good point. Prescription drugs are specifically excluded in Medicare. You have to buy that from the private sector, from either a standalone prescription drug plan or part of a Part C Medicare Advantage plan.
And then you said something about that it wasn't all inclusive, that it had like co-pays and deductibles. How do you pay those? Because you know those could get pretty high.
Well, you're welcome to pay them out of pocket, but it's very not advisable. The co-pays and the deductibles and the other responsibilities, financial responsibilities you have in Medicare can be quite severe. Part B is designed to pay 80% of doctors and procedures, which would be a heart surgery or a cataract surgery. You would have to pay 20%. So in order to be well insured, you're going to have a private insurance policy from a private insurance company, and it's going to work with Medicare to fill all those gaps. And there's a couple of ways you can do that.
So, you know, that made me think about like when my mother was sick. She had a big hospital bill. Actually, I saw it. It was $250,000. So if she didn't have private insurance, she would have owed like 50 grand.
Oh, more than 50 grand, because when you, under your hospitalization coverage, you have the first $1,400 of every hospital stay. It's not a deductible that's once a year, it's a per stay fee. So every 60 days, if you're out, if you leave the hospital for 60 days, go back in, start with a fresh 1,400.
And there's no cap?
There is no cap.
Wow, that could get pretty expensive.
So that's why the supplemental insurance is considered not an option.
Okay, that sounds like something that everyone really needs to do. So when we think about that, like, how do we actually sign up for Medicare?
We sign up for Medicare through the Social Security Administration. You go on the Social Security website, you click in on the top corner where it says sign in, sign up. You open up the next screen, and down in the bottom left corner, you'll see a small line that says Medicare. You click on that and you enter the data and click enter, and you're signed up.
But, you know, years ago, people all got their Social Security at 65 years old, but Social Security has changed. So now some people take it early. Right. And they take it at 65. Other people wait till their full retirement age, and then other people still wait till the maximum age of age 70. So when you're thinking about that, well, if you're 65 and you get Social Security, does that happen automatically? You get Medicare?
Yeah. If you're a traditionalist and you retire at 65 and your employer coverage ends, and you go on Social Security and begin to collect, you're automatically signed up for Part A and B. Then all you do is select how you want to get your supplemental insurance, and then you go. If you're still working after age 65, it's different. You can stay on your employer health plan without penalty, as long as that plan covers more than 20 people, and it's employer sponsored, and you can defer Medicare till when that plan ends for you. You will probably want to sign up for Part A anyway, because it's free, and hospitalization coverage that comes to Medicare is excellent, and it would act as a secondary hospitalization coverage to your primary insurance. But Part B you have to pay for, and it's rather expensive, and it would be redundant to your group health plan. So you would wait without penalty till you've finished working and ended your retirement plan. The third choice would be you're over age 65 and you're retired, and you're not working, you're not collecting Social Security. If you're that person and you want health insurance, you have to sign up for Medicare. It's your only choice.
What if you decide, I don't want to sign up for Medicare? Is there a penalty? There's
no penalty till you change your mind. And when you do change your mind, if you are late and you're outside your election period, you'll pay a 10% penalty for Part B for each year you should have had it that you didn't. You'll also pay a 1% penalty each month you didn't have your drug plan that you should have. And those penalties, when you do sign up, are added to your premium, and they're there for the rest of your life.
Well, that's pretty steep. So they're going to make you pay for that, not doing it forever.
Well, the idea of insurance is that everybody signs up. They need people at age 65 to contribute. If everybody waited until they were sick to go get Medicare, the system financially would collapse.
Yeah, we both know the system already has its issues. So
it's in the process now of struggling, but it would definitely collapse if that were the case.
Okay, so when we're thinking about that, and I'm thinking about, I'm just thinking about clients in general and the way they think, one of the things they worry about is, one, what's healthcare really going to cost them in retirement? And, I like thinking about it as the public and the private portion, because people don't realize that you have to pay both sides.
Exactly.
So let's talk about the public portion. What does that cost?
Well, Part A, like I said, is free, and that's a deal. That's a good deal. Part B, for most people, costs $144.60 a month in the year 2020. Last year it was less. It went up $9 this year. It can be more. It's income-based. It can be as high as $397 in addition to the $144 if you're a high-earning individual. They look at your earnings for the last 2 years, and I would advise people who are approaching age 65 to plan, to look at their income. And if they're close to one of those thresholds, the threshold for the first level is a single person, $87,000, married, $174,000. If you're within $1,000 of each of that, it's time to sit down with your advisor and see if there's something you can do to mitigate that.
It's funny that you said that, because we've had situations where people have had to pay more money for their Medicare, and they didn't know why, because they said, well, we're only living on $80,000 or $100,000. Why? They didn't realize that the capital gains they had in that year, even though they didn't take it, right, sold their home, or maybe a required minimum distribution that they didn't expect to be large is now larger than they expected because they deferred taking money from their IRAs for years. And now all of a sudden they have a lot of income. Even if they're reinvesting it, they're going to charge them more money towards their Medicare. So I think that's a really important part of financial planning that people don't focus on in retirement, but really need to make sure that they're not going to pay more for something they could pay less for.
Right.
So that's on the public part. So that's 144 minimum, going up to as much as maybe $500 a month.
So we'll say 144.60 for Part B. Part A is free, but then you have to supplement the public portion with private insurance. First off is your drug plan. You can either buy a drug plan from a standalone drug company. They sell prescription drug plans for people on Medicare. The average premium is somewhere around $40. There are good plans that are more, and there are good plans that are significantly less, especially in our area. And then there's also the option to buy a Medicare supplement plan. And the Medicare supplement plan is designed to fill the gaps in Part A and Part B that the Medicare doesn't pay, such as your hospital deductible and your 20% that you owe as Part B. So with the Medigap plan and the drug plan and Part A and Part B combined, you have comprehensive medical coverage. You also have a choice to use a different method to get your Medicare. You can buy a Part C plan. A Part C plan is a bundle. It includes all the coverages that are in Part A, all the coverages in Part B, and a prescription drug plan under one group plan, very similar to the coverage that you had as an employee of, and as a member of an employer-based health plan. It has a network. You're going to have a primary care physician who's going to refer you to specialists. It's managed care. It's much less expensive in many cases than a Medigap plan, a Medicare supplement plan, but it's managed care. So you find what works best for you at a price that you can most afford and continue on.
You know, again, something that I've come across over the years is that people buy it one time and they never look at it again. We had a client that came in here and they were struggling with money. And we were talking about their budget, and I was looking at some of their expenses they were paying for their Medicare supplement. And I asked them to look at the plan, and we looked at it and we reviewed it. And after reviewing it, we realized that we were able to save them money on a different plan that was actually more appropriate for them.
Correct.
And they thought that, you know, once you buy it, it's it. You know, this is what I bought, this is what I need. I must need this for the next 30 years of my life. But would you think that people should review their Medicare supplements on a regular basis?
Oh, I would. That's why there's an annual election period every fall in October. It starts on October 15th. It goes to December 7th. And during that period, you're allowed to change to a different plan if you want without penalty. And the reason that they do that is in the beginning of October each year, the insurance companies have to submit their plans for the next year. And many times they change the plan. Well, you signed up for this plan at age 65 and they've changed it. And now it doesn't necessarily suit you as well as it did before. It would be in your best interest to shop. Or maybe the plan doesn't change, but your health changes. And it changes in a sometimes dramatic way. Now you need a different type of a more robust health insurance plan so that your out-of-pocket is less, and you're going to pay more in premium to have those out-of-pocket less because you're going to be using the services much more. That's why we sit down with my clients, and I sit down every year during the annual election period or just before, and we review the new plan, make sure it still fits, their budget, and dial it into their current health situation. This is not like when you had a group health plan and it was more or less thrust upon you. This is what we have and you're going to take it and one size fits all. Absolutely not in Medicare. One size does not fit all. And it's your responsibility because you're individually insured to find the plan that's best for you each year.
You know, it's really interesting because what you said about the group health insurance, with group health insurance, whatever you have, your spouse has, right?
Correct.
This is really different in that you could buy one type of plan for yourself and your spouse could need a completely different plan.
Good point.
And many times you probably shouldn't have the same plan.
It will be rare to have two people who have exactly the same health situation going forward. If your health is better and your spouse's health is much worse, maybe it is appropriate for you to have two separate plans.
Now, if your health gets worse, do you have to, do you have to prove insurability to get a different plan?
You can change during the annual election period. There's no, there's not a look back. You can just change your plan as you see fit. During the rest of the year, just remember that when you sign up for that plan, it's going to start on January 1st, and you need to look at it as a one-year contract with that health insurance company. There's situations where you can change, but they're rare. And for the most part, you're going to have that plan for the year. You're going to have that drug plan if you choose a drug plan for the year. It's impossible to predict the future, but you do the best you can in the fall when you're picking your plan. And the next fall, you go sit down. My clients and I sit down every year and we review these. And if it's appropriate to make a change, we do so.
You know, again, something I think about is that I've come across so many people that have underinsured themselves because they think that that no premium plan is the best plan for them, but they never took into account everything that they actually spend money on.
Oh, yeah.
And if they would have spent a little bit of money on a supplement plan that was more appropriate, but I don't think they really know, because if you think about it, when did you have to learn about health insurance? Really, when you were 65. We've spent all these years in the working world really not having to understand how health insurance really works. And then at 65 years old, the government thrusts upon us the fact that we actually have to understand it. And that's one thing that we want to make sure that we do understand, because health insurance is one of the most expensive parts of a retirement income plan. What we find as financial advisors is that people underestimate how much money they're going to need for health insurance. And when we look at their budgets, we need to actually add more. And people say to Brian and me all the time, you know, why are you increasing our budget there? We're healthy. And we're like, that's great. We hope you stay healthy forever. But we also know that your health is not going to get better from the time you're retired to the time you die. So we need to make sure there's enough money there. So making sure you have the right plan, and again, that you're not overpaying for something that is probably one of the most expensive parts of your retirement, is probably one of the most important things.
I agree. I tell people to look at it as a large bucket with money in it that you have at age 65, and it should have enough money in it for your health care and your long-term care for the rest of your life. Well, at age 65, if you're healthy, you want to take as few dollars out of that bucket as possible so that they're available to you when you're older and you're using your health care more. That way, that money lasts you through your life. And if you need expensive procedures when you're older, you have the money for them.
You know, we talked about a lot of what Medicare covers, and you made a really good point about the fact that it covers, the government covers 80% of it, and that supplement really is made there to cover some of the holes, the 20%. But what does Medicare not cover?
Well, original Medicare does not cover ancillary things like vision and dental is a huge one, especially in retirement. It's difficult to imagine all of our teeth lasting all of our life. I mean, those problems happen, and implants and things like that and crowns are very expensive. That's why a lot of people opt for that Part C plan. It's the bundle plan, because in a Part C Medicare Advantage plan, those companies and those plans are allowed to offer ancillary benefits like dental and vision and extra things to entice you to join their plan. They run them so efficiently and they're so profitable. The government allows them to offer these things, so you can have all of your coverages under one managed bundle. You can also have a Medigap plan, Medicare supplement, and a standalone drug plan, and buy a dental plan and a vision plan off the street. I mean, they're available, they're reasonable. Know that coverages for dental and vision are roughly the same as they were when you were working in an employer-based health plan. You have insurance, but the coverage is limited. And you can find yourself, even with good dental insurance, out of pocket big money for the wrong kind of dental problems.
Yeah, I always find that interesting, because people think when they buy vision insurance and they buy dental insurance, they shouldn't have to give the dentist any money. And they're always surprised where I'm like, trust me, I'm not on Medicare and I still give the dentist a lot of money. So I think that's, you know, kind of important to realize that they're only there to supplement, not to supplant, not to make sure that it doesn't get rid of all your expenses, but to help you with expenses. And you really have to weigh out whether or not that's valuable to you or not.
Right. In some cases, they're just not worth it.
Yeah, I would agree with that. I really think that every situation is important.
Unique.
And, as I listen to you and I think about, planning to make sure you don't pay too much for your Medicare, as well as deciding whether or not a Medicare Advantage plan or a Medigap plan is better for you, I really think that people must need help with this. I really think that people make decisions really without knowing. I can tell you the other day I was on the phone doing a review with a client, and we were talking because he had just turned 65 years old, and we were talking about the fact that he wanted to take Social Security when he was 66. And I said, did you apply for Medicare? He goes, yep, I did it. I went online and I did it. Even though I'm not taking my Social Security, I was like, oh, that's great. I said, did you get a Medicare supplement? And he said, yeah, I got a Medicare supplement. I said, what'd you get? And he said, I don't know, I got it through AARP. And I said, well, that's good. What did you get? Because he kind of goes between two different states. And he said to me, I don't know, let me send you the card. So it was interesting. He emailed me over the card. And what I realized was he bought the drug plan, but he never bought a supplement plan. So I explained to him when I was talking to him is that, do you realize that you only have 80% of, if you get sick, 80% of your doctors paid for. The other 20% could be a bill to you. He goes, no, I didn't know that. And this is an engineer. This is a smart guy. This is a guy that spent his life knowing a lot about a lot of different things, but no one ever taught him this. It wasn't, there wasn't a class that taught him, I got to buy a supplement.
I find it time and again that someone will turn 65 and they'll ask their friend, what'd you get for your supplement plan? And they'll tell them, and they'll say, it's great for me, I love it. And they go and buy it. And I say, well, your health situation isn't the same, or financial situation isn't the same as theirs. And on top of that, how do you know they bought the right plan? So now both of you may have the wrong plan. So we offer to do this service for people because it's important to get you on the right track, to get you doing the things that you need to do every year. You need to be your own best advocate. It's almost one of those things that you don't have a choice in. I mean, no one loves to learn about insurance, but when you do begin to learn about Medicare, you'll find it's logical. It makes sense.
Yeah, and I do think we do need to make sure that we're educating the community about this, because this is something that every one of us has to do, and we don't want to find out we did it wrong. And that's kind of why we decided to start with the Healthcare and Retirement series. And I want to thank you for coming here today, because this is the beginning of Medicare teaching. And again, next week, we're going to really take a deep dive into Medicare Advantage plans versus Medigap plans. But if people from today have questions, which I'm sure they do, how do they reach you?
Well, they can just reach me here at the office. We're at 585-241-5250, or you can email me at david@legacyfp.net. I'm happy to get right back to you.
Well, we know we're going to see more of David next week as we continue to talk about Medicare. I hope that all of you out there that are watching invite your friends, because this educational series, something that Brian and I are committed to doing, it's very important to us, as it always has been, to make sure that we are educating the community to make them better for retirement, making sure they are safer in their planning so they can live the rest of their lives without financial risk. So I hope you enjoyed today, and we look forward to seeing you again next week.